She's the independent expert on the right to health appointed by the Human Rights Council in 2020 and warns that the conditions in Gaza today are incompatible with the realization of the right of everyone to the highest attainable standards of physical and mental health.
Not only is Israel killing and causing irreparable harm against Palestinian civilians with its bombardments and their allies, they are also knowingly and intentionally imposing famine, prolonged malnutrition, and dehydration. I remain concerned at the ongoing risks of water and airborne diseases, lack of medical and surgical supplies and commodities, and the lack of sexual and reproductive health and mental services. The many complex injuries and resulting disabilities and complications created as a result of the type of military arsenal used puts disability rights also into focus.
She argued that Gaza's medical infrastructure was irreparably damaged just days into the over 6-month conflict, and that as a working medical doctor, she's witnessed the very practice of medicine being under attack. Dr. Mofokeng's damning assessment comes amid reports that mass graves have been unearthed at the Nasser Medical Complex in Gaza's Khan Yunis, just weeks after Israeli troops withdrew from the southern city. Estimates put the body count at close to 200, while mass graves were also reportedly discovered at the Al-Shifa hospital complex in the largely destroyed north. Dr. Mofokeng called for leaders within the multilateral system, regional blocs, academia and civil society among others, to abandon what she describes as a self-imposed passiveness or quiet diplomacy.
The number of widespread violations of the special protection afforded to civilians, including the horror that children are specifically subjected and exposed to, and violations related to lack of protection of medical personnel under international human rights law and international humanitarian law has been immeasurable. Despite international calls and demands for an immediate ceasefire, the shameful war continues, and Israel's allies continue with the despicable acts of international cooperation in ways we've never seen before, and supporting to occupying in a regime with billions of dollars in aid, weapons, political power, and cover from accountability.
She also highlighted the psychological trauma inflicted on the population after months of military bombardments, damage she believes will be intergenerational.
We see the physical injury, and because it's physical, one can appreciate the severity of it. But the acute mental distress that will then turn into anxiety and other kinds of mental illnesses later on in life is really, really important to start thinking intentionally about. And all of the support should be accompanied by psychological and mental health practitioners who are specifically, with expertise to support in these kinds of contexts. Imagine living under the constant anticipation of a bomb, of a gun, of being shot while you're trying to get food or water or play. That is in itself a form of violence, to anticipate that your life could be distinguished in any moment. And for children to grow up with that level of trauma is not normal.
Emphasizing that the current state of Gaza was completely incompatible with the right to health, an issue Dr. Mofokeng wants at the front and center as the power brokers struggle to resolve this moment of crisis. Sherman Riceby's SABC News, New York.